What I'd like to talk to you about today is arthritis and chiropractic. Now, a lot of people assume that if they have arthritis or any sort of degenerative joint disease, degenerative condition, that effectively painkillers are the only option for them. Now, what I'd like to try and share with you today is how chiropractic can help people with degenerative conditions that are otherwise commonly referred to as wear and tear. What we have here is the Kirkcaldy-Willis model of spinal degeneration. Now, this is a well-established clinical model, and it illustrates the changes that happen through each stage of life as one goes from their early 20s into their 30s and 40s, 50s and 60s and beyond. Now, my youngest patient came to me when she was 4 years old, and my oldest patient is currently 90 years old. Now, what I'd like to explain here is the common denominator between all of these and hopefully help you realise yourselves how chiropractic care can actually help. Now, if you take a normal vertebrae, you'll notice that the joints are very, very clean, crisp structures. The discs are very large, fat, healthy structures that help to cushion the weight between the vertebrae. That's important, incidentally, because you need the cushioning between the vertebrae to keep the weight off the joints, which then in turn allows the joints to move and glide around freely. Now, the first thing that's going to happen as you approach your 30s and 40s, you're going to probably notice that you're a little bit stiff, perhaps when you get up in the morning, maybe getting out of a chair, you're just a little bit tighter than you were previously. And in reality, what's probably happening there is that the discs are starting to undergo a degree of dehydration. Now, again, if we compare this to a normal disc, you can see here, normal disc here, dehydrated disc here. Now, what happens when you lose the weight bearing between the vertebrae is that you naturally have an increased onus on the joints to bear the weight of the vertebrae. So the joints end up going from being extremely mobile to being slightly less mobile. Now, this stiffness is essentially what you experience, like I said, in your 30s and 40s when you're just not quite as flexible as you used to be. Now, this is a perfect time to come in to see the chiropractor, because obviously minimal structural changes occurred to the spine, and it's very, very easy for us to manipulate those joints, restore mobility, and help give you exercise advice to strengthen the core muscles and basically preserve this at this stage. Now, if you're unfortunate enough to have left it to this stage, obviously treatment is going to be a little bit trickier, but you're not quite beyond help just yet. Now, obviously you've lost even more disc height, which leaves even more weight bearing on the joints. By this stage, you've probably had this process going on for perhaps 20 to 30 years. And the effect is that the joints have gone from being nice clean structures, as you see here, to really rough, worn structures that you see here. Now, clearly, admittedly, this is going to make manipulation very, very tricky. So chiropractors at this stage in life, we're talking probably 60s, we tend not to use the same techniques as we'd use in younger individuals. We use much more gentle techniques called mobilization to essentially stretch the joints and prise the joints open over a period of time. It's a mistake to think that chiropractors only use one technique, and it's a mistake to think that we are going to have you on the table and we're going to wrench you around and all that business. That's a complete mistake. We'll take the age of the person into consideration, whether they have osteoporosis or not, any current medical issues, as well as obviously the degree of arthritis, and we will amend our techniques to achieve the same goal as we would for anybody, which is to effectively restore movement to the joints, strengthen the muscles, and try and get function back. Now, this stage represents the Kirkcaldy-Willis phase 3 degeneration. Now, unfortunately at this stage, you can see that you have lost essentially all your disc height. You can see here how the spinal nerves have become extremely weak, again compared to the healthier nerves that we see at stage 1. You can see here how the joints have become extremely rough, and all in all, this area has now fused. So unfortunately, this patient is beyond manipulation at this particular level. However, there may be other vertebrae compensating around this particular spinal segment, and perhaps movement can be regained there. But all in all, this would represent quite a tricky case. This would be someone very, very later on in life, perhaps 80s, 90s and beyond. But again, for that type of patient, we would amend our techniques. We would definitely not use traditional manipulation. We'd probably just try and help that person stay flexible through exercise advice.